Chapter 22, Therapeutic Agents for the Gastrointestinal System. I'll skip through the terms and definitions, but we'll go through them as we progress through the lecture. In the beginning of the chapter, we have the common drugs for conditions of the gastrointestinal system. This chart's really nice, again, because it has the pronunciations of all the generic medications. So it's a really good practice. So I definitely recommend going through all of those and trying to say them all a few times. As I said before, these are very common, so you will see them in the pharmacy quite a bit. The digestive tract extends from the mouth to the anus and converts food and fluids from absorption and distribution. Insoluble large materials break down to absorbable smaller substances for energy production, protein synthesis, and as enzymes for metabolism. As the body breaks down food, it absorbs nutrients and excretes non-essential remnants. And this chapter, we will talk about the anatomy and physiology of the GI tract and discuss medications and conditions. The GI system carries out four main roles: digestion, absorption, metabolism, and excretion. The parasympathetic nervous system directs various rest and digest activities of the GI system. These auxiliary organs, so like the stomach, intestinal tract, tongue, salivary glands, liver, pancreas, and gallbladder. These are all accessory organs that are important for digestion. Most consider the stomach the primary GI organ. However, digestion begins in the mouth. Figure 22.1 shows the entire system. And again, the organs that we're going to discuss in this chapter in sequence are mouth, salivary glands, pharynx, and esophagus for ingestion and digestion. The stomach and small intestine follow for digestion and nutrient absorption. The large intestine reabsorbs water, electrolytes, and stores feces, and the rectum and anus remove the waste. Auxiliary organs perform various supporting roles. So here is the complete anatomy of the GI system, including the mouth, pharynx, esophagus, stomach, and intestines. The mouth begins digestion by breaking down food into smaller pieces through chewing. The mouth's three pairs of salivary glands are the sublingual, submandibular, and the parotoid. They secrete enzymes and start the food's chemical breakdown. The sublingual and submandibular glands sit below the tongue and jaw, respectively. Peristalsis is involuntary muscle contraction and relaxation, which begins in the esophagus to propel food downward. As the food arrives in the stomach, it enters an acidic environment that further breaks down chemicals in food. Figure 22.3 shows the major glands of the mouth. Sorry, 22.2 shows the major glands of the mouth, and 22.3 shows the pH of the stomach related to other liquids and products. So you can see this is stomach acid, and that's the most acidic. It's like the most acidic thing. The stomach's acidity can impact drug and mineral absorption. Drug interactions can occur between acid-lowering medications and medications that need an acidic stomach environment for proper absorption. Food activates gastric juice, a combination of hydrochloric acid and various enzymes. The enzymes allow the intestines to absorb the nutrients and chemicals for metabolism. However, the stomach's acid can destroy medication. Some medications use a special protective coating. Other medications, like insulin, need an injectable form to bypass the acidic stomach. That's one thing people ask me all the time. Students, customers, patients, why is there not an insulin that you can just take by mouth? Why does it have to be an injectable? Well, the reason why is because it would not last as insulin in our stomach acidity. It would break down and it wouldn't work. So that is why it has to be injected. And they do have a new inhalation form of insulin, but it's not very popular. Several types of stomach muscles aid in digestion by churning and mixing the gastric contents. Chyme is the semi-fluid mixture that remains. Chyme exits the stomach and passes through the pyloric sphincter, a muscle that opens into the small intestine for further digestion and nutrient absorption. The pancreas produces bicarbonate to neutralize the acidic contents as they pass from the stomach to the duodenum, the first part of the small intestine. So this figure 22.4 is the structure of the stomach. You can see here's the esophagus going into the stomach. Here is the lower esophageal sphincter. So that is a little sphincter that opens up and closes. So that way stomach acid doesn't back into the esophagus. And down here, here's our stomach moving into the duodenum. So you can see this is where stuff is traveling from the route here to the duodenum. And right here is the pyloric sphincter. So that's another sphincter that's opening and closing to allow the food after it has been chymed into the duodenum. Absorption of nutrients occurs mainly in the small intestine. The vitamins and minerals move through the gut lining. The small intestine's length and multiple folds and villi increase its absorption surface area. Glucose molecules, amino acids, and fatty acids absorb and begin to circulate through the bloodstream for delivery to the body's cells. The small intestine, about 6 meters long, performs the final digestive steps. Figure 22.5 shows the wall of the small intestine. It has 3 sections: the duodenum, the ileum, and the jejunum. These 3 sections of the small intestine absorb most of the food and oral drugs. The alkaline intestinal pH allows for good nutrient absorption. The large intestine, which is only about 1.5 milliliters long, follows the small intestine and absorbs mostly water and electrolytes. The substances moving through this portion of the intestine form solid fecal matter as water and electrolytes reabsorb. The rectum, the shortest section of the intestinal tract, follows the large intestine and connects to the anal canal. Normal fecal waste matter removal takes from 3 to 5 days. In the anal canal, the involuntary regulated internal and anal sphincter controls the urge to defecate. The external anal sphincter, under voluntary control, gives the individual management of the bowel. The body converts proteins, carbohydrates, and fats from complex molecules to simple molecules. The pancreas, liver, and gallbladder produce enzymes that are carried by ducts to the duodenum to help this action. Trypsin and chymotrypsin from the pancreas break down large proteins into smaller peptides and amino acids. Amylase breaks down large carbohydrates into disaccharides, which are 2 sugars. In the duodenum, the body breaks disaccharides and monosaccharides, which is 1 sugar, for easy absorption and energy needs. Long carbon chains of fat are difficult to metabolize. Bile, which is produced by the liver and stored in the gallbladder, helps the body absorb fats and fat-soluble vitamins. Emulsification, the breakup of fat globules, makes fats water-soluble, and lipases further break them down. Figure 22.6 provides a visual summary. So it kind of gives you visual and explains everything, the whole entire process, going from the mouth to the anus. Hyperacidity treatments such as antacids, histamine 2 blockers, and proton pump inhibitors help alleviate heartburn, upset stomach, and symptoms of GERD. Laxatives and antidiarrheals can speed up or slow the passage of contents through the bowels to treat acute or chronic constipation and diarrhea. Immunosuppressants and steroid anti-inflammatories serve to treat inflammatory bowel conditions such as Crohn's disease and ulcerative colitis. Combinations of antibiotics and acid reducers are used to treat H. pylori organisms, which are often found in gastric and duodenal ulcers. The stomach acid fluids can cause stomach upset, indigestion, or heartburn, and acids like calcium carbonate and magnesium hydroxide work quickly to increase gastric pH and relieve occasional stomach upset or heartburn. Histamine 2 antagonists such as famotidine and ranitidine, which ranitidine has been removed from the market now, or PPI such as esomeprazole and omeprazole start their work a bit more slowly but need less frequent dosing. Patients can easily access these medications. Most are now over the counter, and they should contact their doctor for persistent GERD or pain that may signal a peptal ulcer. So if you look at the back of any of those products like omeprazole, which is Prevacid, it will tell you that you should only use for 2 weeks. Because if you have a peptic ulcer, we don't want you just taking medication for it if you have a severe symptom that you need like an ulcer to get rid of. Gastroesophageal reflux disease can occur when the upper sphincter at the top of the stomach relaxes. This allows the stomach's acidic contents to back into the unprotected esophagus. So I was kind of talking about this when we looked at that full picture. Patients feel this burning sensation in the chest around the area of the heart, which is also known as heartburn. Risk of GERD increase with obesity, smoking, and pregnancy. Antacids include aluminum carbonate, sodium bicarbonate, calcium carbonate, magnesium hydroxide, and aluminum hydroxide. Each of these generics name is the inorganic molecule's chemical name. Antacids neutralize acid and increase the stomach's pH level to make it less acidic. Table 22.1 lists examples of single ingredient antacids. So just kind of said that. Tums is calcium carbonate. Milk of magnesia is magnesium hydroxide. We then have combination antacids, which have aluminum hydroxide and magnesium carbonate. Some even have simethicone. So like Maalox, Gaviscon, Alka-Seltzer Gold. They have sodium bicarbonate, aspirin, and citric acid. This one has sodium bicarbonate, citric acid, and potassium bicarbonate. H2 antagonists bind to H2 receptor sites, reducing acid secretion. The rare side effects of histamine antagonists include drowsiness, headache, and rash. Prescription formulas typically are stronger than OTC formulations. So we have Pepcid, which is famotidine. It's over the counter. We have ranitidine, we have Zantac, which used to have the generic name ranitidine, that has been removed from the market. And now if you find Zantac in the stores, it's going to have the same active ingredient or the same generic name as Pepcid, which is famotidine as well. Proton pump inhibitors, which we abbreviate as PPIs, are used mainly to treat GERD and peptic ulcers. Most agents are a once daily delayed release form. They block gastric acid secretion, and currently the only ones available OTC are esomeprazole, Prevacid, esomeprazole is Nexium, and omeprazole, which is Prilosec, and omeprazole / sodium bicarbonate, which is Zegraded OTC. So here's a list of the histamine 2 antagonists that are all on the market, besides, of course, ranitidine, proton pump inhibitors, and more information about them. PUD, which is peptic ulcer disease, is a chronic condition of stomach and or duodenal ulceration. Occasionally, esophageal ulcers appear. PUD's primary symptoms include abdominal pain, relieved by food or antacids. Drugs like NSAIDs and bacterial infection, H. pylori, are leading causes of PUD. They damage the stomach, duodenum, or esophagus by affecting the body's natural defenses. Patients can get H. pylori through food, infected water, or person-to-person contact. Healthcare providers often treat H. pylori with a PPI and 2 antibiotics to minimize drug resistance and side effect of a single antimicrobial agent. And table 22.4 lists the first line recommendations for the treatment of H. pylori infection. So patients who are not allergic to penicillin would do this regimen, and patients who are allergic to penicillin would do this. And some patients who are allergic to penicillin or have failed their first course of treatment for H. pylori would follow this. Two of the most common symptoms affecting the intestinal tract are diarrhea and constipation. Infections caused by bacteria, viruses, and parasites can result in diarrhea. Tumors and other blockages can cause constipation. Patients can often treat diarrhea or constipation with OTC medications. However, some medications cause diarrhea or constipation. To prevent constipation, many healthcare providers recommend taking a stool softener, such as docusate sodium, to patients taking opioids and other constipation-causing medications. Chronic inflammatory bowel conditions, such as ulcerative colitis and Crohn's disease, can cause diarrhea, but these disorders need aggressive prescription therapy. After a bowel resection for tumor removal or other reasons, the patient may need to wear an ileostomy bag or a colostomy bag. Ostomy bags attached to the abdomen with adhesive strips. The intestinal contents empty into the bag through the stoma, which is the opening. Ostomy sites vary depending on the location of the resection in the bowel. Nutrient absorption takes place throughout the intestinal tract. Therefore, ostomy sites close to the stomach result in fewer absorbed nutrients. Patients with ostomies often need nutrient supplements, and a person can live a normal life with an ostomy bag. Special pharmacies provide ostomy care supplies. The types include a colostomy bag, a surgically created opening in the abdomen wall that allows feces to pass from the bowel through the stoma rather than the anus. A colostomy may be temporary or permanent due to cancer of the colon or rectum. An ileostomy bag is a surgical opening made through the abdominal wall into the ileum to allow for fecal passage. An ileostomy may be performed in patients with colon cancer, severe or recurrent Crohn's disease, or ulcerative colitis. Inflammatory bowel disease comprises two major disorders, Crohn's disease and ulcerative colitis. Although both conditions fall under the umbrella of IBD, Crohn's disease and ulcerative colitis have distinct clinical traits that distinguish them. Table 22.5 provides information on select agents to treat these conditions. And 22.8 is a comparison of the basic features of Crohn's and ulcerative colitis. So here is the Crohn's and here's ulcerative colitis. 22.5 again, select agents for the treatment of inflammatory bowel disease. Crohn's disease is a chronic inflammatory intestinal disease that can cause ulcerations in the small and large intestinal lining. It can also affect parts of the digestive tract. Crohn's disease is a close relative of ulcerative colitis, which we just talked about. Remicade, a very popular intravenous infusion, is used for Crohn's disease, ulcerative colitis, rheumatoid arthritis, and psoriasis. So once you are working in the pharmacy for some time, you'll notice that a lot of medications for autoimmune disease like Crohn's disease, ulcerative colitis, rheumatoid arthritis, psoriasis, psoriatic arthritis, stuff like that, they're going to all be used to treat, some of the medications are going to be used to treat all of this stuff. A lot of medications can treat all of those symptoms. Ulcerative colitis causes inflammation and sores in the lining of the large intestine or colon. Ulcerative colitis affects only the colon and rectum, where Crohn's disease can affect the entire GI system. Symptoms of ulcerative colitis include stomach pain, cramps, bloody diarrhea, or bleeding from the rectum. Some patients experience fever, loss of appetite, and weight loss. Ulcerative colitis symptoms can resemble related conditions, and the prescriber should rule out an infection as well. So we have Asacol HD that can treat mild to moderate ulcerative colitis and Crohn's disease. Patients with irritable bowel syndrome, IBS, have chronic abdominal pain and altered bowel habits. IBS is the most commonly diagnosed GI condition and affects men, women, young patients, and the elderly. GI doctors list IBS as responsible for 25 to 50% of all referrals to their office. Abdominal pain associated with IBS can range from mild to debilitating. Altered bowel habits vary from episodic diarrhea, constipation, and alternating diarrhea and constipation. So we have the medication Bentyl, which is an oral form that helps IBS. We have Lotronex, which is diarrhea prominent IBS for oral use. Amicia, IBC with constipation in women. Also idiopathic and opioid-induced constipation as well. Diarrhea is an abnormal increase in the frequency, fluidity of bowel movements. Abdominal cramping, gas, and general discomfort may accompany it. There are two main types of diarrhea, acute and chronic. The acute type is short-term and is often caused by viral and bacterial infections. In chronic diarrhea, symptoms continue for longer periods, generally lasting 1 month or more. Diarrhea can have many causes, including colitis, GI tumors, metabolic disorders, and infections. In cases of severe infectious diarrhea, the number of bowel movements may reach 20 or more daily. Although treatment depends on the cause, diarrhea is usually treated with antidiarrheal agents. As diarrhea continues, the patient loses fluid and electrolytes. If not replenished, death can occur, making diarrhea a significant cause of death worldwide. Select agents for treatment of diarrhea are in 22.6. We have the medication Lomotil, which is a controlled substance, Control 5. Pepto-Bismol, Imodium, Metamucil, which are all over the counter. Constipation manifests as hard, dry feces or infrequent or irregular bowel movements. Some people have bowel movements once to several times daily, whereas others may normally have them less often. Narcotic pain medications like codeine or oxycodone, antidepressants, anticonvulsants, calcium channel blockers, and aluminum-containing antacids can also cause constipation. In table 22.7, we have the select agents for the treatment of constipation. We have bulk-forming laxatives, which are just over-the-counter, Citrusol and Metamucil, stool softeners like Colace, which are over-the-counter, osmotic laxatives like Miralax, which is now over-the-counter, Bisacodyl, a stimulant laxative, same as Senna. We talked about Amicia. Senna Plus has Docusate and Senna in it, so both a stool softener and a laxative. Then we have this new medication, Movantik. It's a opioid antagonist, and this actually is usually given to people that take opioids that have constipation. Bulk-forming agents like psyllium work by absorbing water from the body to increase the moisture and overall bulk of stools, allowing for easier elimination. Health providers may refer to them as bowel stabilizing agents. Docusate improves the ability of water in the colon to penetrate, mix with, and soften the feces. Healthcare providers generally employ stool softeners as a preventative measure rather than an active constipation treatment. Stimulant laxatives cause the muscles of the small intestine and colon to propel their contents rapidly. So like Dulcolax, Senna. Osmotic laxatives like Miralax and Lactulose are agents that remain in the GI tract and hold water already in the colon to soften the stool. The nitrogen, carbon dioxide, and methane byproducts of microbial breakdown cause flatulence. People who are lactose intolerant do not have the lactase enzyme in the intestinal lining. This hinders their capacity to metabolize the carbohydrate lactose and results in poor digestion of dairy products. Poor food absorption allows undigested food to reach bacteria in the small intestine or colon, thus producing flatulence. Symptoms include bloating, discomfort, and pain in the abdomen. So we have Gas X and Phasime, which are both simethicone that are used for the relief of gas and abdominal distension caused by gas. Emesis is a synonym for vomiting. The medulla oblongata controls this violent action. Smell, pain, medication, motion sickness, and emotions can activate the chemoreceptor trigger CTZ. When activated, chemical signals travel via the nervous system to the vomit center, which relays this message to the stomach. The muscles of the diaphragm, stomach, esophagus, and salivary glands work in concert to vomit. Nausea and or vomiting is often an isolated event. Other causes include food or drug poisoning, alcohol overconsumption, pregnancy, or a post-surgical reaction to anesthesia. Chemotherapy patients may contend with extreme nausea and vomiting as the agents activate the CTC, causing emesis. Drugs for vomiting are called anti-emetics. Most require prescription, but a simple sugar formula like Emetrol is available over the counter. For nausea, we have medication called, it has doxylamine succinate and pyridoxine, which is a form of vitamin B6. The trade name is Diclogis. We have the medication Raglan, which is indicated for nausea and vomiting, available oral or intravenous. Compro, which is indicated for nausea and vomiting, that is available as oral, intravenous, intramuscular, or rectal suppository. Tigan, which can be administered oral or intramuscularly. Zofran, Zofran ODT, and Zooplens are used for nausea and vomiting, usually chemotherapy induced, but now it's becoming more popular for pregnancy and just regular nausea because it works very well. It is used for oral and intravenous IVs. Meclizine, which is an oral medication like Dramamine, which helps with travel sickness and motion sickness and vertigo. Colorectal cancer is a relatively common form of cancer and it has a high mortality rate. Although this rate has decreased, it remains the fourth most common cause of cancer-related death worldwide. The medication Avastin is indicated for colorectal cancer, non-small cell lung cancer, and renal cell cancer. It is administered intravenous. The medication Camptosar is indicated for colorectal cancer given intravenously. And at the end of the chapter, of course, we have these sound-alike drugs. So just be aware of those as you go into the field.